My name's Miad Najafi. I'm a registered osteopath here in the UK. I'm also a physiology graduate. I'm a Brazilian Jiu Jitsu black belt, and I've been involved in martial arts for over 25 years. I've boxed to a reasonable amateur level, and I have some background in JKD and Filipino martial arts as well. So in one way, shape or form, I've been involved in physical training for over 25 years, and I was particularly interested in putting together this program, which is called the Grapplers Longevity Program, and it's really about empowering the athlete, the grappling athlete particularly, with more knowledge about their body and creating awareness about some of the problems and problematic areas of our bodies, and to give you a series of maintenance exercises that will allow you to train regularly and to train for the long term. So we want to be training consistently. I'd love to tell you guys to take a day off in between training sessions, but we know that that's not going to happen within the Jiu-Jitsu community. So regular maintenance work. This is not necessarily designed to treat any injuries as such. So if you have any problems, any injuries, it's important you go and see a medical practitioner, be it an osteopath, a physiotherapist, or your doctor. But this is really about keeping you mobile, keeping the aches and pains at bay, and allowing you to train consistently well into your 40s, 50s and beyond. This particular video is on the neck, the cervical spine, and we have a spine here, so I can talk to you about the structures that make up the cervical spine, because that's very, very important. So there's three main functions of the cervical spine. One of that is for it to support the skull, so the skull sits directly on top of the skull. It is to protect the spinal cord as it runs down into the spinal column, and it is to help with the movement of your eyes. You're increasing your field of view as well as moving your head. The anatomy of the area is quite complicated. It's made of 7 cervical vertebrae, originally termed C1 to C7, and these are made up of a vertebral body. So you have a vertebral body along the front, you have transverse processes that come out on either side, and then you have spinous processes that come out at the back. And the only part of it that you'll be able to feel yourself on your spine is the spinous processes and the little gaps in between those spinous processes, particularly if you move your head up and down in your lower neck and upper back. But it's not just the bony elements that make up the spine. We have joints that sit along the back aspect of the cervical column, and these are called facet joints. They're small, kind of knuckle-sized joints that are covered in cartilage. You have very strong musculature around the back of the neck, and we've got very important musculature on the front of the neck, which particularly is important in aiding our stability, and particularly for the grappling athlete that needs to be worked and to aid stability. There's obviously ligamentous structures. These attach bone to bone, which help with maintaining the integrity of the spine. As you can see here, this red vessel here is a vertebral artery, and there's actually an artery that runs through the neck, through the transverse processes that I've mentioned. It doesn't actually exist in any other part of the spine. It's only in the cervical spine, and that goes up and supplies your brain. It goes actually into your skull. One of the other very, very important structures of the cervical spines are the discs, and these are structures that sit in between the vertebral bodies, and there are two main parts of the discs. There's a gel-like material, come with like toothpaste consistency, that sits in the middle, and that is called the nucleus pulposus. The names aren't really important here. I'm just throwing it out there for anybody that wants to do any further reading. And that acts as a shock absorber between the vertebral bodies, And then on the outside of that, containing this gel type material, are rings of ligamentous structure, and that's called the annulus fibrosis. And they're like layers of an onion. They're kind of ligamentous structures, and they aid in the flexibility of the spine, and they actually help with obviously keeping the spine in place and maintaining its integrity as well. All of these structures, they all come together to form the cervical spine, and one of the characteristics of the cervical spine is that there is a slight curvature to it. Now, it is very normal for us to have a slight curvature going forward. It's a convexity forward, and there's a concavity in the back aspect. So that's very normal for us to have a slight curvature, and that helps with weight distribution and the shock absorbing properties of the spine. If we were too straight or if we were too flexed, it would make the spine weaker and more vulnerable. So ideally we want about a 60-degree lordosis in the cervical spine, and that's really the optimum curvature that we'd be looking at. So all in all, the cervical spine is quite different from the other areas of the spine: the thorax, the mid-back, the thoracic spine, and the lumbar spine. These have very different structures. The thoracic spine is very stable because it has strong ribs, the bony elements to support it, and of course the lumbar spine has this very strong muscular corset called the abdominal wall, which makes the cervical spine the most mobile and the weakest. Therefore, it's the most vulnerable part of the spine, and we need to be very aware of that as athletes going forward, if we want to have a long career in rolling around and doing jiu-jitsu, grappling, submission wrestling, and so on and so forth. So what we're going to talk about now is the main ranges of movement that happen at the cervical spine. So the first movement is a flexion movement, which is a movement forward. It's the head coming forward relative to the rest of the body. And then we have extension, which extends up. And as you can see, when we extend, you open up the front aspect of the spine, and when you flex, you open up the back aspect of the spine. Most of the flexion extension happens in the lower cervical spine, which makes the lower cervical spine quite prone to degenerative changes. And then we have side bending, of course, so bending down to the sides and front body here. So that's your side bending, okay, one way and then the other. And we're going to be going through this in the exercise program following this. One other very important role of the cervical spine is obviously rotation, and that is turning the head over your shoulder so you can actually look behind you. Very, very important, and most of that happens in the upper cervical spine. So it's the first two segments where most of the rotation happens. There are other vectors. There's posterior and anterior shift. So there's like a shearing motion. This is like slide and glide motion, where the top vertebra slides on top of the bottom. And then there's lateral shear. So it's a shifting from one side to the other, which is exactly the same thing. They're just like it's more of a slide and glide movement rather than a flexion extend or side bending movement. There is another accessory movement called distraction, which is when the joint surfaces are taken apart. I can't do that myself actively. That needs to be a force being put into it. And there is a very important vector called compression. And compression is particularly specific to grappling. There's not many sports that put compression forces through your head and your neck. Grappling is quite unique in that sense. There's only really a few exceptions. Contact sports like rugby and American football, they put quite strong compressive forces, and this is something that for us to be very aware of. In jiu-jitsu, when it comes to the tie-up, when it comes to guillotines, when it comes to like stacking, if I want to really stack somebody, I'm going to be putting quite strong flexion and compression forces, which puts quite a lot of pressure on the discs, some of the soft tissue structures as well, and we really need to be aware of the potential for injury when it comes to compression, how we can minimize its effects, and how we can maybe slow down some of the negative aspects of repetitive compression and repetitive force flexion that we may be undergoing. Okay, now we're here at the exercise end of the program. So one of the things that I would say about these exercises is that we never want to work through the pain. This is not about eliciting pain. You should be getting no more than a 2 or a 3 out of 10 for discomfort, within the relative pain-free range. So a slight teasing sensation of taking the joints and the muscles and soft tissues apart a little bit, but not really working through the pain. We're going to start off. Most important thing we do is our starting point. So our stage 1 needs to be very good, and that starts by just opening up our shoulder and what the yoga calls mountain pose. So Eunice is just going to do that, rolls the shoulder open and then just drops the chest down and then rolls the shoulder open, and now he just lets the arms just hang, okay, nice and loose, nice and relaxed. Okay, we're going to start with the chin slightly tucked in, and we're going to go, the tongue is on the roof of the mouth, the jaw is relaxed, and the lips are sealed. And we're going to just gently go up into an extension. And what you want to try and do is make sure that some of the extension is happening at your back. You're not just hinging at your chest, you're not just hinging at your lower back. And then you're going to go into flexion. So again, slow and deliberate. You hold the end of range for about a second. We take it from flexion through its full expression with coordination, not just bouncing it from one end to the other. Generally, I work between 8 to 12 reps. You can play around with what's suitable for you and what feels right, but each one of these exercises should be about 8 to 10 reps, and you can play around with some of these will be more effective for you than others. Some of them will really work some of your tissues, but this is a real general approach to mobilizing your neck and your mid and upper back. So this is the most simple vector of the cervical spine. Then we're going to go back into a neutral position. Again, when we go into a neutral, generally we want our chin just ever so slightly tucked in. I almost want to have a sensation that you're lifting from the crown of the head so that there's a nice smooth curve at the back of your neck. So now we have side bending, which is sometimes it's called lateral flexion, and this is when we're going to be dropping our ear towards the same side shoulder and trying to avoid the other shoulder hitching up, okay? So again, these shoulders are nice and hanging from the cervical spine, hanging down, nice and heavy, slow, deliberate and controlled movement, not working through any pain, not bouncing, and trying to really get a sense that these tissues are teasing apart. Probably sit about like a second at the end of range just to feel those muscle fibers and ligaments getting a little bit of a stretch. And again, 8 to 10 reps. When we go back into neutral, we're now going to be doing rotation. So again, ever such a slight tuck into the chin, lifting from the crown of the head, and now we're going to rotate, okay? No, we're going to just be here, we're going to just turn his head, so he's going to face me like so, okay? So that's the rotation, and then again, slow, deliberate, feeling the end of range, feeling those fibers stretching. And this is one of the things about this kind of movement. It is not just about the stretch, it's about the articulation. It's about taking that joint, getting those joint surfaces rubbing against each other, getting those muscles used to being active and getting teased at the same time. This is really, really important what we're doing. We don't just want to be throwing our neck around willy-nilly, okay? Great. So now what we're going to do, we're going to combine those three movements. So the flexion, extension, the rotation and the side bending all gets combined into circumduction. So we can start by going down into the side bending. We're going to rotate, again keeping the tongue on the roof of the mouth. You'll notice that this helps support the anterior neck musculature. When you come back down into neutral, into the front flexion position, I go back the other way. Again, slow and controlled. Deliberate movement. This movement has to be deliberate and conscious. Again, 8 to 10 reps. You can probably spend about 20 minutes on this whole sequence. Maybe you can actually spend more. Just be aware of that. I think that this is a very good investment of your time.
out of all the things that you could be doing for your body in between your jiu-jitsu sessions, when it comes to keeping that neck mobile and healthy. So now what we're going to do, we're going to go into some of the side bending vectors that we showed, side shift vectors that we showed earlier. So again, this is a slight angle here. So what Eunice is going to do is almost like someone's just pushing him at the angle of his jaw here, and we're going to open out the thing. So it's a little bit, yes, exactly. Okay, and again, trying to keep this upper back and the mid and the chest nice and relaxed. 8 to 10 reps of this, really getting a sense of those joints moving on each other, really getting an articulation, and that's where we get a lot of nourishment from our joint surfaces, is actually helping the fluid within the joints and really loosening it off with movements like this. Good. Now, again, after 8 to 10 reps of that, we're going to do anterior posterior shear. So we're going to jut the chin out. Okay, we get a little bit of a forward head posture, and then we're going to draw the chin back. Okay, exactly. So we're going to slide, anterior slide and posterior slide. So it's very common that people want to lean forward, almost like they're feeling like they're doing more, but less is more in this position. Keep that upper back relaxed and really try and bring this movement from the lower neck and really pulling that up. That's really excellent if you can get that sense of elongation going through the spine. 8 to 10 reps of that, and again we can now develop that a little bit further by putting those two motions together. So we're going to create what I call a composite shearing motion, which we're going to reach out with the chin, we're going to pull back, and we're going to rotate. Again, I like to put my hands on my chest when I do this. It almost kind of forces me to stabilize my rib cage, and I don't cheat that way. Okay, but you can have your arms down as well. That's it. Again, trying to get this sense of our joints and our vertebra moving on top of each other, helping with fluid mechanics, and helping with stretching the soft tissue structures. The names are not necessarily important with any of these movements. It's more that you're aware of what we're actually trying to do. Don't get too hung up on the names of any of the anatomy or necessarily even the movements. That's not important. It's more about feeling is the important aspect of it. As we talked about before, with the massive compressional forces that happen throughout our spine, one of the things that is of great relief is distraction, which is the vector of pulling our head away from our neck. So we get a little bit of a gap. One of the interesting things, and very important things with regards to that, is not only are we very prone to getting over-compressed in jiu-jitsu, is that the nourishment of the discs to prevent degenerative changes and to get nourishment, the discs, taking the disc surface, the joint surfaces apart, creating distraction in between those vertebra is actually how the discs get nourishment. They don't have a particularly good blood supply. There's something called imbibition. So when we take the joint surfaces apart, it helps with rehydrating those discs. And that's one of the reasons why when we lay down, when we wake up in the morning, we're a little bit taller than when we at the end of the night, and that is because when we're flat, fluid goes back into our discs and gets our discs nice and juicy and plump. So now we're going to show a very effective way to create a distraction. Sometimes in the medical field or in physiotherapy field, this is called traction. Traction is not the correct term for it, because traction actually means surfaces coming together, and what we want to do is take these joint surfaces apart. So Eunice is going to take the knife edge of his hand, he's going to put it on the base of his skull here, just at the edge of the curvature here. So really, that's it. So just where the skull meets the neck. The elbows come forward, and again, he wants to get this retraction of the chin, so the chin tucks in, and what you're going to try and do is just lift a little bit here from the hands as you push back into your hands with your head. So that will create a little bit of stretching and moving. You should feel a slight opening up here at the upper back and lower aspect of the neck. Again, you can hold it for 3 to 4 seconds, then let go. 8 to 10 reps of that is gonna do your discs a lot of good. So now we're going to come on to the thoracic spine, and it's very important for us to realize that our neck is not a standalone structure, that we've got very strong attachments to the rib cage and to the upper back. So it's important that we get this area mobile, and particularly in our sedentary work, a lot of the time we're sitting on the computer all day, very, very tight in our chest and our mid-back, and our neck really takes the brunt of it. So the more mobile we are in our mid-back, we can take a lot of pressure off our cervical spine. So first things first with our mid-back is, again, the movement's got to be quite focused, so we're going to have our palms together like so, a little bit of engagement here, okay? Now we're going to keep that chin tucked in, and it's almost like Eunice has got a laser beam shooting out of his chest that's firing in between his hands, and what he's going to do is just lift that up. It's very little movement. It shouldn't be a lot of movement. No movement happening in the lower back and then coming back down, okay? Right? So again, a laser beam coming out of his chest and just creating a little bit of movement here, up and down, okay? What you'll notice is when you extend, anything that opens up the front body usually is with an in-breath, and anything that closes the front body is with an out-breath. So that is with extension and flexion like we did earlier. Try and use your breathing with these exercises, it can really help. But again, tongue on the roof of the mouth, jaw nice and relaxed. And what we can do here now is we can just make a little circle one way with the same principle. Not much happening in the lower back, nothing happening in the neck. It's just coming out of this laser beam right in the middle of the chest. Circle one way and then circle the other. And again, you should feel a little bit of movement there in the thoracic spine or the mid-back. Now we're going to come in with the next exercise, okay? I'll call these the arm swings. Your arm is going to be at shoulder level. I'm going to look at my fingertip from my shoulder level as I loop the arm back until it gets to shoulder level. So again, this is now starting to integrate the upper limb with the chest and the neck, okay? So here, rotate, look at the shoulder, and you'll see that rotation starts to happen all the way through the spine. We do that on both sides, okay? Shoulder level to shoulder level. Don't do this too quickly, you'll get dizzy. Slow and controlled. And again, look, the head, the eyes, the chest, the upper limb, all getting engaged to be moving as one unit, because effectively that's always what we're doing in Jiu-Jitsu. We're not really isolating the body. We're trying to use as much of our anatomy as possible when we're engaging in our Jiu-Jitsu, and our exercise regimen should reflect that. That's the main vectors with regards to that. Now we are going to really move that shoulder blade on top of the rib cage, okay? So a lot of our muscles can get tight, our chest muscles, our lats, all those muscles that keep our shoulder blade tight and protect our neck when we're doing Jiu-Jitsu, they need to be moved around. And this is particularly tricky for us to move this area because of the anatomy, as I said, with the ribs and so on and so forth. So again, using your breathing, taking that rib cage, articulating the shoulder blade over that rib cage as much as you can. And again, this is the reverse of what we're doing all day when we're sitting on laptops and devices. Opening that up, and the arm and the chest becomes much looser this way, taking the pressure off the neck accordingly. So this is another very, very integrated form of exercise for the mid-back and the neck, and this is very good, particularly if you've got some degenerative changes or you've maybe had a bit of a background with some stiffness in the neck, because this really moves the nerves as well as really articulates the nerves in and out the foramens that come out of the cervical spine, but also it starts to integrate both shoulder joints, rib cage and the neck all together. So what we've got his palm up against the door frame or an edge of a wall. The elbow is about 45 degrees. The chest is a little bit engaged. So we're just pushing gently into the hand, and we're going to look at that opposite hand. Now this other arm reaches out, and all we're doing here is just making a circle as we articulate this part of the chest and the shoulder, and he's going to keep this engaged. So you can see how much his neck muscles are engaging here, and you can probably get a sense of how much we're actually teasing some of these muscles apart, because one of the things about jiu-jitsu and grappling in general is that we never want to be in vulnerable positions. So we never do the things that we need to do, which is like open up our chest, we're always doing the opposite. We're always trying to protect, we're trying to keep ourselves in a strong shape constantly. So anything that takes us into these extreme ranges in jiu-jitsu is generally not good for our jiu-jitsu, but what we need to do is counteract that with regular exercises that does take the joints and the tissue through its full expression. So again, you can do 8 to 10 reps of that in one direction, circling in one direction with the hand, and then circling the opposite direction. Once you've done that, you turn the head, you look towards the swinging arm, and we're going to do exactly the same thing. And now we're going to create a little bit more of a stretch on this part of our neck. And again, the chest is engaged, a little bit of pressure through the wall, and the elbow is at 45 degrees. Again, we're going to articulate that shoulder through, stretching the neck, stretching the chest, getting that rib cage working. So this exercise is about opening up the back aspect, the posterior elements of the spine, and we're going to have the hips and the pelvis up against the wall, knees are nice and soft, and what we're going to do, lifting a little bit from the chest, from the back of the crown of the head, chin ever so slightly tucked in, and what we want to do with this is a slight micro nod, so just a slight bit of nodding. Doesn't need to be too much. If you've set this up correctly, it will only be a little bit of nodding that goes on. And again, tongue on the roof of the mouth and jaw is nice and relaxed. Work your breathing with it a little bit, hold the nod for a second, and then come back out of it. So it's really about just trying to get a little bit of articulation happening at the spinal level without being too flexed forward. So this is trying to get the ideal alignment with the ear running through your shoulder, running through your hip. Okay, so now we are coming down to a few more exercises that we're going to do on the ground, and these are really developed for helping with stability of the neck and particularly working this anterior musculature of the neck, which needs to be strong and active for the grappling athlete. So what we're going to do here is we're going to do the same thing. The head is going to come off the floor, but it doesn't need to come up too much into a flexion. You can actually almost bring the head like in line with the shoulder, basically, so your ear is in line with the shoulder, chin slightly tucked in, and what you can see here is Eunice's anterior musculature, these muscles on the front of his neck are engaged and working. So keeping that chin tucked in, and that is what we can do here from a holding position. And we can rest down, please. Just going to do the next exercise now. So we're going to bring the head up off the bench, off the floor, chin is tucked in, and we're going to ever so slowly rotate one side and then the other. Okay, it doesn't need to be a big rotational movement. Keep that chin tucked in, come back. That's it. And we're going to go to the other side. Again, 8 to 10 reps of this. This is basically a sit-up for the neck, and will really help to develop that front musculature and help with the stability. Again, tongue on the roof of the mouth, jaw is nice and relaxed. Don't clench your teeth too much, and really you'll start to feel the burn. 8 to 10 reps of this and you'll start to feel the burn. Okay, and then we go back into neutral. Okay, rest down, giving Eunice a little bit of a break, and the next one is going to be same thing, chin tucked in, head is close to the floor as possible, and now you're going to bring your ear towards your shoulder with maintaining the chin tuck. Okay, almost like you're trying to squeeze a tennis ball between your chest and your jaw. Okay, and again, this is very, very deep musculature that's being activated. Tread carefully with this, and you'll start to feel again the burn. 8 to 10 reps, no more than that, and you can do maybe 2 lots of those or 3 lots of those if you're specifically working on working the stability. So now we're going to go into sideline position. So he's going to face you here. So we're nice and relaxing, knees up towards your chest a little bit more. Good. We're here, a little bit of pressure through the floor with the upper arm. chin tucked in, and it's the same thing. You can rotate to the right. He's going to come up, rotate to his upper shoulder, again coming back. It's more important you maintain the chin tuck than you do too much rotation. Okay, going back up into right rotation, chin tuck. Maintaining that chin tuck is very, very important. And then back into neutral, and now you can look down at the lower shoulder. We're going to rotate down, maintaining that chin tuck, tongue on the roof of the mouth, never working through the pain, only 2 or 3 out of 10 for discomfort. No severe pain, no sharp pain. And again, as you can see that these muscles are really, really firing and really, really active. Looking straight ahead. Okay, now we're going to do the side bending, so he can drop this ear towards the shoulder. Good, and now he's going to pull this back up. Strong muscles here needed to take the weight of that. Jaw relaxed. Good. And then the last lot is that you're going to bring this ear to the upper shoulder. Again, keep the chin tucked, so it doesn't need to be too big, the movement of the side bending. Yeah, it just needs to be enough to get those muscles firing, and you'll start, I'm sure Eunice is feeling the burn there, and we'll start to get fatigued, and the more we do this, the less fatigued we'll get. Okay, so again, never working through the pain, just touching discomfort. Okay, now we're going to go on to our front. You can do that exercise on both sides, by the way. You go on both shoulders to do that. And then we're here again. Now we're going to work the posterior musculature. So this is the musculature a little bit more here. Again, same thing with the chin tuck. And we're going to be rotating, and then we're going to rotate to the right. Okay, and then back into neutral, and then rotate to the left. Back into neutral. So this won't be as demanding in terms of the strain on your muscles as the previous exercises. Keeping that chin tucked in, you've got to get that real draw here, exactly. So you want to try and get that smooth articulation between smooth curves happening, no sharp bends that's happening in your spine at all. And looking straight ahead, and then the same thing, chin is tucked in, we're going to side bend, we're going to bend down to the side. Okay, so really using these muscles, but maintaining the chin tuck is very, very important. Good. Play around with the reps in terms of what you feel like, but again, you should be able to do most of this sequence within 20 minutes at a time, and then you'll play around with the exercises that are most suitable and that you'd get the most benefit from as you get more and more experience with the sequence. And that is your exercise regimen. We've gone through our exercise program. You've become more aware of some of the anatomy, some of the problematic issues that can happen in the neck. And I just wanted to just touch on some ergonomic advice, and advice particularly when it comes to using computers, laptops, tablets, and telephones. The main thing that the main principle that you want to try and use when it comes to all of this is you want to keep your head above your hips. You want your ears in line with your shoulder, so your head doesn't stoop forward in this direction. The best way to do that is to try and get your screen at eye level, and the top third of your screen should be at eye level. That's easier to do when you have a desktop. That's much harder to do with a laptop because you have to look down because of the nature of it. So what I do suggest, if you have to work for long periods on laptops, I would suggest that you get a stand for your laptop and a separate keyboard so you can put your screen at eye level. It's absolutely epidemic. People are sitting there in bed playing around on their laptops, laying on their side, playing on their tablets. This is not very good for our neck, and it actually is going to compromise your ability to be able to train for the long term. So ergonomic advice: head above your hips, chin tucked in ever so slightly. We want to get this smooth curvature behind at the back of the neck. and we want to be lifting from the crown like so. Screen at eye level and try not to look down. Even if you've got a phone or a tablet, try and bring it up, maybe even rest your elbows on your chest so you can look more forward than having to constantly look down. That forward head pressure, that every inch that your head goes forward in relation to your shoulders, it actually puts about 5 kilos of weight, 5 kilos of force onto the cervical musculature. So it's really, really important that we keep ourselves aware of this and don't let ourselves go into this stooped, collapsed position when we're working or when we're on computers and then having to hyperextend our neck. This is going to create problems for us down the road. That's one thing that I would definitely suggest that you become very aware of going forward. There's other things that you can do. You can consider supplementation, maybe fish oils. There's other anti-inflammatory supplements that, bromelain, for example, that comes from a pineapple. It's a pineapple extract. There's serapeptase. There's things like turmeric and ginger that you can incorporate into your diet, but you can also supplement with that. These are all things that are known to have potential anti-inflammatory effects. So if you are a bit flared up, if you are in pain, definitely go and see your practitioner. But there are maybe other more natural supplements as well that can maybe help alleviate some of your symptoms, but maybe help with the inflammation of vigorous training regardless. There's also cold hydrotherapy, which I wanted to talk about. Cold showers, cold plunges. There's a large body of evidence about some of the beneficial effects of that, particularly when it comes to inflammation and to aid recovery from vigorous training. Look that up, but most of the research is suggesting that we don't do it immediately after vigorous exercise, and that we do it at least 1 or 2 hours after hard training. So try not to come out of the gym and have a freezing cold shower, but explore that sensibly with someone that can guide you through it and is qualified to do so. Otherwise, we're going to be putting more videos together with regards to the Grapplers longevity program. We're going to be doing stuff on the lower back, we'll be doing pelvis, the lower limb, the shoulder girdle, and the upper limb. So we will be exploring that in the coming weeks and months. Check out those videos, but enjoy your training, stay mobile, stay safe, and enjoy your jiu-jitsu.